Hello, my name is Amelie Stritzke. I'm a neonatologist, or a baby doctor in the Department of Pediatrics, and I'm also the current program director of the Pediatric Residency Program here at the University of Calgary.
My name's Preet Sandhu. I'm one of the hospital pediatricians here at Alberta Children's Hospital. I'm past program director for the program, but I have an interest in simulation for education, and that's where this combination came together. This is a program that was actually started by the provincial eSIM team. I was lucky enough to connect with their team and design some pediatric-based simulation scenarios that we could then adapt their adult program to for our pediatric residents. So they created and evaluated a series of simulations that were based around Indigenous health to improve participants' comfort in managing and looking after this patient population, and also to increase some knowledge and awareness around resources available to help provide best care. So the simulations ran over the course of a couple of afternoons last spring. So a simulation is an educational strategy that's focused on experiential learning. So you take participants through a scenario and have them simulate what they may do, and then in conversation and debriefing after can go through some key learning points and help move them forward for when they actually encounter this in actual practice.
We are planning to continue those simulations. We had a great resonance, like people were very happy and liked them. And it serves a need for the residency curriculum as well as for actual care of these patients and communities. It's not unique to our hospital, but I want to say we have one of the most established and most famous simulation programs across Canada, because we have the researchers that are very much bringing up simulation in medication and also in medical education in our hospital, and we have lots of courses around simulation, which really helps to weave it into our curriculum and have this an integral part of what we do.
I think what made this program unique was we were focusing not only on the medical pieces of looking after pediatric patients. For the context of Indigenous child health, we were able to focus on key communication skills and resources that are available for Indigenous child patients that perhaps our learners may not otherwise have had exposure to. A couple of things that I really thought made this program a success were, one, that we were able to partner with not only the provincial eSIM team, but we also partnered with the AHL's Indigenous Wellness Corps, and several members from that team also joined us for these afternoons. So as a result, we started each afternoon with a smudge ceremony and prayer, and along with going through some of the key learning points from our perspective, we had participants and leaders share some of their lived experience, either working in the Indigenous Wellness Corps or their own experiences being members of the Indigenous communities in Calgary. So I think that really lended something to the experience that we wouldn't have had without their participation.
Oh, this very much resounds with the Thriving Together, because with the Indigenous simulations, we really helped weave a connection to outside of our hospital here. Like, we weaved a connection to our community partners and especially Indigenous communities. And I think it's something that we don't get a lot, so it's something very special, and actually it was very much requested by the residents. So having more Indigenous health out of the curriculum and to learn more about them and really go out and do outreach, and really thriving together is the only way forward. And this helps residents be equipped with knowledge and skills and background experience in order to best take care of Indigenous families and patients.